Hello everyone, it's Dr. Taiba and this video is about the ovarian pathologies on ultrasound. We will compare the normal and abnormal appearance of ovaries. Starting off with the normal views of left ovary, then the longitudinal view. It is more wider and has multiple follicles, and in the transverse view it is taller and we can see the follicles inside the ovary. Similarly, for both the views, longitudinal and transverse views with follicles visualized. Starting off with the first case, ovarian cyst, these are anechoic, rounded, thin bed with posterior enhancement, and they are usually more than 3 centimeters in diameter. Is a small cystic structure at the periphery of its dominant follicle, and it's a sign of ovulation. Corpus luteum is formed after the ovum is expelled into the fallopian tube, and it is a thick wall structure. By using Doppler, we observe peripheral vascularity. This peripheral vascularity is called the ring of fire, and we can also have internal echoes which are inside the corpus luteum. A hemorrhagic ovarian cyst can occur from rupture of corpus luteum or any other functional cyst. It has internal echoes due to blood products and absence of flow on Doppler. Hemorrhagic corpus luteum showing peripheral vascularity. That is the ring of fire, and it also has internal echoes due to blood products. Endometriosis, also known as chocolate cyst, have unilocular appearance. Unilocular means single compartments. These locules are compartments, so this one has only one compartment, and it has thick walls and these internal echoes like ground glass appearance. And it has solid cystic components. This one is cystic, slightly lower in ecogensity, and this is the solid component. Slightly more in ecogensity, cyst adenomas have an echoic appearance and are unilobular, and this is again one compartment, and this is called unilobular. And this one is anechoic as compared to endometrioma, which has not anechoic. Serous cyst adenoma carcinoma is the malignant form. It is comprised of heterogeneous appearance and more solid components, and the patient may also have ascites. Cutaneous cyst adenoma is larger in size and has lots of molecules. There are many lobules in this cyst. Adenocarcinoma is a malignant form and has more head solid components and heterogeneous components. The walls of the locus are more hyperechoic. Cysts are also called mature ovarian cysts, teratomas, or echogenic masses with attenuation. And they also have fluid filled levels. These are two different fluids with different densities. The dermoid plug, also called rocky density nodule, is hyperquick structure due to hair tooth, sebaceous, or calcific components. It is more likely to be malignant. The dermoid mesh is formed from hair inside a cyst, and this forms gives a dot dash pattern. These are thin echogenic bands which gives this type of appearance. Another feature is the floating ball sign, which are fat globules inside the cyst. These are hyperechoic fat couples inside a hypoechoic fluid. Ovarian fibroma is a benign tumor of the ovary. It is a solid hyperechoic mass which may sometimes have cystic ovarian teratomas is another benign tumor of the ovary, but it is non-specific on ultrasound and has variable appearance. Metastasis appears as solid hyperechoic masses in the ovary which gives a specific eaten appearance. They appear as these hole-like structures, and this type of metastatic lesions are also known as Rockenberg tumor. Paravariances are simple cysts outside the ovary and they move independently when transducer pressure is applied. Are simple cysts outside polycystic ovaries occur when there are more than 20 cysts inside an ovary, and the follicle size can range from 2 to 9 millimeters due to multiple cysts. This gives a specific appearance called the string of pearls. Since here we have string of pearls, the cysts are lined up together and they look like just like pearl strings. In ovarian hyperstimulation syndrome, the ovaries are enlarged which could be more than 12 centimeters. They have lots of cysts and these cysts gives a spoke whale appearance. In ovarian torsion, the ovary can appear enlarged would be more than 4 centimeters. There will be absence of blood flow on Doppler. Here we can see there is no blood flow inside. When the Doppler is applied and the ovary is appearing hyperechoic as well. A classic sign of ovarian torsion is the whirlpool sign. Because the ovary is twisted, it gives us this type of appearance, and this appearance is called the whirlpool sign. Using Doppler makes the whirlpool sign more prominent. As you can see, the shape of the ovary is looking just like that whirlpools that we see in water. Another important sign which might be noticed in some cases of ovarian torsion is the follicular ring sign. It is a thick hyperechoic margin around the follicles which can measure 1 to 2 millimeters.